There is a condition called irritable bowel syndrome that many patients have already heard of. This is because the symptoms of irritable bowel syndrome are very common. These symptoms comprise abdominal pain or discomfort, bloatedness or cramps, and they are often associated with changes of bowel habit or stool form. So a patient may also complain of either loose stools or diarrhea, or constipation or hard and pellety stools, or they may have alternating hard and loose stools. Many patients feel that these symptoms are so intense that they interfere with life and work. And indeed, it is true that irritable bowel syndrome is one of the largest causes of economic loss due to medical downtime and medical treatment. Irritable bowel syndrome may comprise up to 50% of the referrals that a gastroenterologist may have because it is so common in the community. In some communities, the incidence of irritable bowel syndrome may be as high as 15% or 20%. And if even a small number of these patients feel that it is serious enough to come to find a doctor for their symptoms, already there are very many patients. The important thing to know about irritable bowel syndrome is that it is a disorder but not a serious disease. In fact, the definition of irritable bowel syndrome includes the fact that no organic disease can be found. Obviously, it could mean that the source of this disease has not yet been discovered, but at the current time, in order to diagnose irritable bowel syndrome, we have to demonstrate, or at least have reasonable confidence, that no specific disease entity exists in the digestive system. Irritable bowel syndrome occurs more in women than in men, and in some races more than others. It is no respecter of age, and children as young as 8 or 9 may have irritable bowel, as well as patients who are much more senior. When we're faced with symptoms that may suggest irritable bowel, we spend a lot of time with patients having them describe the symptoms in great detail, analyzing the pattern and the different aspects of the symptoms, and their relationship with stool and stool habit. We also do a clinical examination to make sure that there is no obvious external evidence of disease in either the digestive system or any other bodily system. And whether we mount investigations or not depends, well, firstly on whether or not the symptoms are very typical of irritable bowel, or whether they may suggest that other more serious conditions may be present. Symptoms that we would worry about, which would make us think about conditions that are more dangerous than irritable bowel, include vomiting, severe pain, the appearance of blood, loss of weight, general tiredness, and lethargy. We would take these symptoms much more seriously. In addition, if patients are slightly older, say over the age of 45, we would pay more attention to excluding serious illness because, as you can imagine, organic disease, including cancers, become more common as we get older.